Good morning everyone and welcome to today's WorkSafe Tasmania Month webinar. I'm Stephanie from WorkSafe Tasmania and also the coordinator of WorkSafe Tasmania Month. I'll also be your moderator for this morning's presentation. Before we do get started though with today's webinar, I'd appreciate you taking a few moments to read the following slide about information delivered during WorkSafe Month sessions. I'd now like to go over a few items so you know how to participate in this morning's webinar. So we've taken a screenshot of an example of the attendee interface. So you should see something that looks like this on your computer screen in the upper right-hand corner. You're likely listening in using your computer speaker system by default. However, if you would like to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You will as well have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You can send your questions in at any time during the presentation. We will collect these questions and address them during the presentation and also at the end of today's webinar. We are as well recording every webinar that we are running during WorkSafe Month and will progressively make these webinars available at the end of WorkSafe Month, which concludes on the 30th of October on the WorkSafe Tasmania website. So do look out for those. And lastly, once you do leave today's webinar, you will receive a survey on the presentation, and we would appreciate you taking a few moments to complete that feedback form and giving us your comments about today's presentation and also your webinar experience. So this morning it is my pleasure to hand you over from IPM Safety, Kirby Dillon, who's going to present this morning's webinar, Injury Prevention Techniques for Manual Handling. Welcome, Kirby.
Excellent. Thank you, Stephanie. So I'm from IPM Safety and I currently work with IPM Safety as an injury management and ergonomic consultant. In this role I work with a number of organisations to assess and control various ergonomic and manual handling risks, and I also do some work as a workplace rehabilitation provider where I assist injured workers to safely return to work. My background is as an exercise physiologist, and prior to joining IPM Safety I worked in clinical environments, and there I worked with a range of patients and clients who presented with different injuries and medical conditions, and I've worked with them to identify strategies and a particular program to assist with their recovery. IPM Safety is a Tasmanian-owned and operated work health and safety consulting company, and we do provide a range of work health and safety consulting services, including training, occupational hygiene assistance, and also injury management and ergonomic solutions. Sorry, I've just lost the screen for a moment. Okay, and so today's webinar we'll be looking at injury prevention techniques for manual handling. And so the first slide I've got here, it's just asking what a manual task is. When we look at manual tasks, the basic definition that we're provided with is it's a task requiring a person to use force to lift, lower, push, pull, carry, or otherwise move, hold or restrain any person, animal or thing. So the big thing is that it's not just lifting. And so it may also incorporate things that we're doing outside of the workplace, so things at home such as walking the dog and gardening, but it is quite diverse and encompasses a lot of different things. When we look at manual handling tasks in the workplace, what we really need to be identifying are what our hazardous manual tasks are, and the Code of Practice for Hazardous Manual Tasks, it does ask us to identify and look out for each of these 4 aspects. So the first thing to look for is the force, the postures, if the task is repetitive, or also if there's any vibration associated with the task as well. So when we're looking at the force of the item, we need to determine if it's repetitive, sustained, high or sudden. Our old code of practice, it did specify a maximum weight that we weren't allowed to lift over in the workplace, and that was 55 kilos. But just placing a specific weight limit on an item, it is very broad, whereas this requires us to actually look at some of the movements that might be required and how long we're handling the particular item for. When we're looking at the postures that might be associated with a particular manual task, we need to determine if they're sustained or awkward. So a sustained posture is a position that we're in for 2 minutes or longer, and awkward postures might be examples of if we're stooping down or working low to the ground, working up above shoulder height, reaching out in front of you, in particular the image that we've got at the bottom of the slide as well. When we look at a work task to determine if it's repetitive, we typically consider a task to be repetitive if it happens twice or more per minute. So it's looking at the number and the speed and the sameness of movements that we are performing. And then lastly, looking at if the task involves any vibration and whether this is relating to whole body or just the hand-arm area as well. And so if we do identify that we have a hazardous level of one of these factors, what we then need to look at is going into identifying some suitable controls to reduce each of those 4 factors there and then minimise the chance of sustaining an injury. And so that looking at what makes a manual task hazardous now allows us to have a good definition of what a hazardous manual task is. So it still has that first part of the definition, so it's any task requiring the use of force to lift, lower, push, pull, carry or otherwise move, hold or restrain. But it must also include one or more of the following. So repetitive or sustained force, high or sudden force, repetitive movement, sustained or awkward postures, and also any exposure to vibration as well. And so the images that we've got on the right of the slide, so we can see working in a production facility, potentially that's quite a repetitive movement. And then the image we've got down the bottom as well, there's an awkward posture where we're having to work below knee height and also handling a particularly heavy item as well. And so I also wanted to just cover a little bit on workplace injuries and some of the injuries that we might see sustained across the workplace. When we look at our workplace injuries, typically only 20% of our workplace injuries are from sudden causes. So that includes things like our slips, trips and falls, handling of a sudden unexpected heavy load, or anything where there's been a one-off occurrence and we've sustained an injury directly from that. An example of that might be is if you're walking along and you roll your ankle. We know it's been that one-off occurrence and you've got immediate pain, and then we're aware that we've got an injury to manage. The other 80% of our workplace injuries that we see are what we call wear and tear injuries, and they're generally from accumulative causes. So specific things that might predispose us to these types of injuries include repetitive bending and twisting, poor work postures, which may include overreaching, working up above shoulder height, working particularly low to the ground, and also the repetition or duration and frequency of our work tasks. And so with each of those factors there is an element of strain, and when we're continuing to perform those tasks, that strain does start to build up in the body and then can potentially lead to an injury. And I guess it's almost like the straw that broke the camel's back. The body can put up with things for a period of time and we might get away with things for a period of time, but it is that injury waiting to happen. So the big focus needs to be on prevention and looking at how we can avoid some of those repetitive movements, improving our work postures, and looking at the duration and frequency of some of those work tasks as well. And so when we look at our body areas at risk, we know that there are various parts of the body that we may be using to perform a particular manual task. The image that I've got on the screen at the moment, we can see that this man is pulling a particular load on a pallet. So each one of those bags positioned on the pallet is a 20 kilogram bag, so there's quite a substantial amount of weight there. And I've just put together an opinion poll. So if we had a worker performing this task, where do you think an injury is most likely to occur? And so if you can select the body area, so whether it's relating to the neck, the shoulders, the back, the knee, or any one of those above areas.
So we'll close the poll in about 10 seconds. So Kirby will close the poll and share those results.
Great. Okay, so we've got 17% with the back and 83% noting any of the above. Yeah, and so when we look at that particular task, we know that we're using quite a large part of the body and what we often refer to as the movement chain. So you can see that using hands, shoulders, we've got to bend at the hips, bend at the knees, and feet are firmly planted on the floor. So potentially we could sustain an injury anywhere throughout that movement chain. Potentially the back, but it may be to any part of that chain there as well. And so when we look at injuries and where we might be most likely to sustain an injury, it really does differ from person to person, and it's quite an individual thing. Some factors that may predispose each of us to particular areas that we're more likely to sustain an injury are things like body composition, previous injuries that we might have sustained, also our fatigue levels, so what tasks that we may have been performing earlier in the day, and if we do have a particular part of the body that is fatigued, and also our age as well. So it really does differ a lot from person to person. We do focus on the back quite a lot, but it is important to remember that we can sustain an injury anywhere throughout that movement chain. And so we've just got this image here which is just highlighting that potentially we see injuries right throughout the body. And so looking at some of these particular areas and what gets injured, we refer to musculoskeletal disorders. So and this is referenced and outlined in the Code of Practice for Hazardous Manual Tasks as well. This is a relatively new term. In the past you might have heard of terms like repetitive strain injury or overuse injury. Essentially they're all referring to the same things, and musculoskeletal disorders is a commonly used term now, and it relates to any injury or disease of the musculoskeletal system. It can occur suddenly or over time as well, and like I said earlier, it's not always the back that we may see sustain an injury. It can be anywhere throughout the movement chain. Some of those particular areas are we might see joints becoming worn out and getting arthritic as well. So as we age, we do start to develop degenerative changes, and some of us will also develop arthritic changes as well. But again, we know that doesn't happen overnight. It is that slow and gradual process, and quite often what we know that can speed up that process or predispose us to some of these changes are handling large amounts of force, repetitive movements, awkward postures as well. We could have a pinched facet joint in the neck or the back. We may see a strain or a tear to a particular muscle, particularly from overexertion as well. When we look at our muscles, they do have a really good blood supply, and if we do sustain an injury, that good blood supply does help to facilitate the recovery process. Looking at the discs in our back, so in between each of the vertebrae in our spine we've got what's called an intravertebral disc, and our discs are basically our shock absorbers, so they do help to protect the back and also provide us with some movement as well. What happens when we have a disc bulge is in the centre of the disc we've got a squishy gel material which gives it that shock absorption, and then around the outside it's more of a cartilage which helps to hold it all in place. And with a bulge we start to see that gel in the middle pushing out towards potentially sensitive nerves and joints. And that may or may not be a problem. We could potentially have a disc bulge without any symptoms, or depending on where that bulge is and what it's irritating, we could have a substantial amount of discomfort as well. Some of the other injuries that we might see a tear or a rupture, and these are our much more severe injuries to the back as well. Another type of tissue that we may see injured or damaged also includes our connective tissue, such as our tendons and ligaments. And if we sprain or tear these types of tissues, generally we have a slightly longer recovery time, and that's because these types of tissue don't have the same great blood supply as what our muscles do, and we generally see that slightly longer recovery time from there. So now what I wanted to have a look at was some of our injury prevention strategies. So a key part of manual handling, managing our manual handling risks is identifying if the manual task that we're looking at is hazardous, and then if so, going on to the next step of making sure that we are able to control the risk. And so the image that I've got on this slide, this is sourced from the Hazardous Manual Task Code of Practice, so it's from page 39, and I find this is a really great flowchart that you can work through yourself to firstly identify if the manual task that you're performing is potentially hazardous. So that's just we can complete that in the first box up on the screen, and so it's got our definition there again. Are we using the body to lift, lower, push, pull, carry? And then when we look at if the task is hazardous, we're looking at the force, so again determining if it's repetitive, sustained, high or sudden. Looking at the postures, are they sustained or awkward? Is the movement repetitive, or if we have any exposure to vibration. Once we've identified that we may have a hazardous manual task, we're then asked to determine what the risk of a musculoskeletal disorder is. So in this part here, we've got a number of questions that we need to answer, and this helps to just flesh out the task a little bit more, and we obtain some more information. So looking at how long and how often are the tasks performed for, and how long are we in these particular postures for, the duration, does it involve high or sudden force, is there any vibration there as well? And then once we've looked at the risk of musculoskeletal disorder, we can then go on and look at the source of the risk as well. So looking at the work area design and layout, so this might include things like the space that we've got available to perform a particular task, perhaps a distance that we might be transporting an item. Looking at our systems of work, so this can include things like our actual workload, also the pace that we're performing at, looking at the nature, the size, the weight or number of things that we're handling as well, so how heavy they are, how often we are required to move them, and then our work environment. So this might include if we do have any exposure to vibration, also the temperature that we're working in, if we're exposed to extremes of heat and cold, the floor surface, perhaps the lighting in a particular area as well. And you'll note down the right of this image, it's got consult, 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 consult at each level. And so this is really a reminder to make sure that we're talking with other employees who may be performing this particular task, so we make sure that we get all the information around that particular manual task, but also seeking additional assistance if you need. And so once we've worked through these first three boxes, we then have a better understanding of what the manual task is, what's the source of the risk, and also the risk of a musculoskeletal disorder occurring. Once we've got all that information, we then need to go and select a suitable control, and this is where we start to work through our hierarchy of control. So the first question is the task necessary? Could we potentially eliminate it and then reduce our the potential for a musculoskeletal disorder occurring? Can we change the source of the risk? Then looking at if we can use mechanical aids, and also what training might be needed to support some of these higher order control measures as well. Our last option, or the last reminder point, is just reviewing. So it's really important that once we've selected a control and we've put it in place, we don't just leave it at that point. We do go and monitor how effective it is and make sure that we continue to get feedback from particular staff who might be working with this control as well. So what I would like to do now is for you as the participants to actually select from a list of examples to work through. So we've got another poll here, and I've prepared some specific work examples, so for the construction industry, hospitality industry, also aged care or administrative and office type environment as well. So if you can please select one of those industry sectors that you have a particular interest in, and then we can work through an example of that and using that flowchart that I've just talked through as well.
Okay, so we'll close it off in another 10 seconds. So I'll close that poll, Kirby, and show the results.
Great, thank you. So we've got construction for 20%, 7% for hospitality, 40% aged care, and admin for 30%. Excellent. So we will perhaps start with an aged care example where we've had the highest number of requests for that particular task. So we'll just move through back to that flowchart again. And so looking at an aged care example, so the example of the manual task that I've put together is if we're required to work with a resident, if we're in an aged care facility who's had a fall from their bed, we've noted that they've fallen into an awkward location, but we've also identified that the room is very crowded, so there's quite a number of pieces of furniture in the room. We've had a registered nurse assess and confirm that we're okay to proceed with transferring the resident from the floor back to the bed, and we've also identified that the resident currently doesn't have that capacity to move themselves from the floor to the bed. We know that we've got 2 care staff available and also a registered nurse who's available to assist as well. So we've got 3 people who are there to assist with the task. So what I'd like us to do now is to firstly determine, is this a hazardous manual task that we are potentially about to perform? And so we can either choose yes or no. So if you would like to just select your response and pop that into the question panel. And then we'll just let Stephanie collate those.
So it appears to be a unanimous yes.
Fantastic. Okay, and so just looking again, if we just refer back to our definition, so we're using the body to lift, lower, push, pull, carry, or otherwise move, hold, or restrain any animal, person, or thing. That's a good summary of what we're about to do. Looking at, is the manual task hazardous? When we look at the application of force, yes, potentially we have a high amount of force. We may be working from a sustained work posture as well, potentially an awkward work posture when we're working from the floor. So that's great to hear that we've got a unanimous yes. Working on to the next step, so we want to now start to determine what the source of the risk is, and before that we can also think about what the risk of a musculoskeletal disorder is as well. So thinking about how long and how often are these specific postures performed or held. So it may take as little as a few minutes, or it could be a particular duration of 10 minutes or longer. Does the task involve high or sudden force? Potentially yes, but we wouldn't expect to have any vibration associated with this task as well. So looking at what the source of the risk is, determining does it come from the work area, the design and layout? Is it a result of the systems of work? Is it due to the nature, size, weight, number of persons, animals or things that we're handling? Is it a result of the work environment? Or is it a combination of one or more of the above factors? So again, if you can just select your response from those options 1 to 5 and pop that into the question panel as well. Thank you.
Again, it appears we have a unanimous 5, so a combination of one or more of the above factors.
Yeah, excellent. And so I think with this example, it is really clear that it's not, there isn't just one source of risk. Potentially it could be a result of the work area, the design and the layout, especially where we've identified that the room is quite crowded and the resident has fallen into an awkward location as well. Potentially looking at the systems of work, having 3 people available is great, but also before we actually proceed with that transfer, determining that we do have the appropriate resources. Looking looking at the nature, the size and the weight, when we are handling people, we do know that it is a very complex manual task, and there is a significant amount of force and unpredictability of movements that we may be exposed to as well. And in the work environment, you know, we would assume that we may have a fairly even surface, adequate lighting and things like that, but potentially there may be a wet area on the floor, or if there's been something spilt and things like that as well. So we would really need to go through and have a look at what each of those, the sources of the risk are as well, and make sure that we're asking all of those questions along the way. So it's great to see we've got a combination of one or more of the above factors. And then so now it's very clear that we've got a hazardous manual task. We've also determined that there may be a number of sources of the risk there as well, most likely relating to the work area and the design and the nature of the item that we're handling. So what we need to do next is to determine what our control option is going to be. So when we identify a suitable control, we firstly need to look at if it's possible to eliminate that work task. Could we potentially make a change to the design, the work area, the layout, or the environment? Could we source new equipment or a mechanical aid? And are there any administrative controls that we could potentially use to assist in that manual task? So again, if you would like to select the option that we would expect to have the greatest change and be of the most benefit for us, and then we can just talk through what some of those controls may be. So if you can pop your answer into the question panel as well.
So on this occasion, I guess we've got a combination of responses coming through. A lot of people appear to be selecting number 3 source, new equipment or mechanical aid. But we've also got a few responses indicating 2 and 3, as well as 1 and 3, for example, and 4 has been selected as well.
Okay, yeah, okay, great. So we've got quite a range there. So we might just talk through each of those possible options that we can choose from and what some of those controls may be. It's not an extensive list of everything that we can look at, but just an overall discussion and review. So looking at elimination of the work task, you know, if we're working with a resident who has fallen, if we're presented with that situation, we do need to be able to assist in safely moving them back to bed. So in this instance, we may not be able to eliminate the task, but we could potentially look at factors to reduce the likelihood of that particular resident from falling. So looking at changing the design, the work area and the layout and the environment, it would be critical to have a look at this. So where we identified earlier on that the room was quite crowded and the resident was in an awkward location, we could potentially go through and do a work health and safety inspection just to determine the amount of furniture that we've got in the room, ensuring that we do have ease of access in and out of the room safely as well, and ensuring that we don't have additional items or clutter that's impeding on our space. We know that if we do have a reduced amount of space, it really does impact on our ability and perhaps make some of our postures more awkward. Our third option, sourcing new equipment or a mechanical aid. So if we're looking at handling of people, we need to be ensuring that we actually use a piece of equipment to assist with us. It's not appropriate to be actually manually handling and moving people on our own. So I will consider this to be a really high priority for us to ensure that we're using a mechanical aid and some kind of a hoist or a lifting device to ensure that we can safely move that resident back to their bed, and that's really so we can ensure the resident safety but also our own health and safety as well. And then number 4, administrative controls. So some examples here may include things like ensuring people have appropriate training and knowledge of how to use a particular piece of equipment and a hoist, how they can safely position the sling behind the resident as well, looking at if they're undergoing training, their communication skills, who's coordinating the transfer. So we could use an administrative control to perhaps support some of those higher level options as well. But for me, the two key ones would be looking at the design and the work area and ensuring that we've got an appropriate mechanical aid and piece of equipment to assist us as well. So perhaps if anybody has any questions relating to that example that we've worked through, if you'd like to pop any of those into the question panel.
We'll give people a few more moments before we continue on to the next slide. A question that has come through, what about the person's suitability for the role?
Yeah, absolutely. So ensuring that the person has the physical capacity to perform the role, that is quite critical. So making sure that they're able and they can safely demonstrate how to use that piece of equipment and how to position themselves in relation to the client that they're assisting with handling as well. Yes, that would be a very high priority.
And a question, what if there are, I guess, suitable aids available and the company won't purchase those aids?
Okay, so that would so when we're looking at assisting with handling of people, it is really critical that we work through that risk assessment process. So what potentially we could look at doing is if there is you know, inadequate equipment and things like that, these are things that we could potentially look at reporting through particular hazard reporting systems that you may have within a particular organisation as well. But those structures might be slightly different from organisation to organisation as well. But making sure that we use the systems and policies that we have in place.
Okay.
Excellent. All right, so I think the item that was selected as the second option to work through a practical example was looking at an administrative or office type environment. So what we'll do now is I'll just talk through another example, but this one will relate directly to more of an office and an administrative type environment. So the manual task that I've selected here, it includes the delivery of stationery supplies. So this occurs at this organisation on a weekly basis. Part of this delivery includes 10 boxes of photocopy paper. Each box of photocopy paper weighs approximately 12 kilograms. At the moment when our boxes are currently delivered, they're dropped off at the front reception area. It's then the responsibility of a staff member to move these boxes to a storage area. The storage area is approximately 30 metres away, and we also know that the storage area is fairly crowded, and this task is currently completed by one person, and we also know that this person may choose to carry 1 or 2 boxes per trip. So given this information, if you can again select if the manual task is hazardous or not, so if you can pop your response into the question panel again.
So the majority of the response coming through is sorry, is yes, with one response coming through saying no.
Okay, so again, if we refer back to our definition, we know that we're looking at it is a manual task, but then if we go through to determine if it's hazardous, potentially we could say it's a repetitive task, so we would be expected that, that the person is handling more than one box and potentially more than two per minute. We may consider this to be a higher amount of force. When we look at the actual weight of an item as well, it really is quite a personal thing, and it differs from person to person as to what's an appropriate amount of weight that we can handle. So one person may consider that this is a high amount of force, whereas other people might consider that that's comfortably within their capacity. So it would really depend on the individual that's performing the task and making sure that they test the weight of the item prior to handling and lifting it. When we are moving them into the store area, where we've noted that it is quite crowded, we may see some awkward postures occurring there as well. So given this information, it could potentially be considered a hazardous manual task. Then looking at our next option, what the source of the risk is. So is it due to the work area, the design and layout? Is it due to the systems of work? Is it relating to the nature, size or number of things that are being handled? Is it a result of the work environment or a combination of one or more of the above factors? So if you'd like to select one of those responses there, that would be great.
Okay, so responses coming through. We have a lot of people saying number 5, a combination. We also have a few responses indicating number 3.
Number 3 as well. Yeah, great. So I agree that there would potentially be one or more of those above factors happening. So looking at the work area, the design and the layout, we know that we have to transport the item approximately 30 metres, so that's a reasonable distance, but we've also identified that the store area is crowded as well, so that is a potential area for improvement. The systems of work, so again that can relate to the actual distance that we need to transport it. Also the fact that it's one person completing that task on their own. Number 3, looking at the nature, the size and the weight. So we know that each box weighs approximately 12 kilograms and there's 10 boxes that we're handling as well. So it's not just a one-off occurrence, it's multiple times as well. And then again looking at the work environment, in an office environment we may expect that the floor is fairly even and flat and there aren't any trip hazards, but again it's something that we could be looking at as part of our review and assessment as well. So once we've had a good look at the source of the risk, we now want to identify a suitable control. So is it possible for us to eliminate this particular work task? Could we make a change to the design, the work area, or the layout or the environment? Is it possible for us to source a new piece of equipment or a mechanical aid? Or do we need to identify some administrative controls? So if again you can select your response and put that into the control panel, please, or into the question panel, please.
So again, like before, I guess we're receiving a combination of responses, so 2, 3, 4, and a couple of responses to number 1.
Okay, great. So we can again talk through each of the potential control options. So our highest priority would be looking to determine if we can eliminate the work task. We would expect that the office type environment would still need to be using photocopy paper, but So we may not be able to eliminate that need for the paper coming into the office, but perhaps we could liaise with a delivery person. So rather than it being dropped at the front reception and then staff have to move it that 30 metres, perhaps we could negotiate that it's actually delivered straight to the store area. So that may be something that we could potentially investigate. A second option, could we make a change to the design, the work area or the layout? Absolutely, we would want to be addressing our storage area where we've noted that it is quite overcrowded and perhaps there's some clutter in there. So we want to ensure that we've got an actual area that's designated for this photocopy paper to be stored in as well. Potentially we could look at making sure that it's not stacked too high and all of those types of things as well. Also just checking that we do have that flat surface with no trip hazards occurring. Looking at number 3, so could we source some new equipment or a mechanical aid? Potentially looking at implementing use of a trolley. That would be a great way, so then we could put a number of boxes on the trolley and transport them that 30 metres to the storage area rather than actually having to physically carry them that distance as well. And then administrative controls might be checking people's manual handling technique that they can safely lift, identifying if this is a one or a two-person task, so is it something where we share the load, and also determining the number of boxes that it's appropriate to carry as well, and that staff are testing the weight prior to lifting and handling the item as well. So that's just been a bit of a general overview as to how you can use that resource. And like I said, it is in the Code of Practice for Hazardous Manual Tasks on page 39, but I just find it a really great resource to go to, and it's got each of those steps that we need to be working through as well. Okay, this last slide I've got here, it's just a summary of some frequently used controls that we see to help manage our manual handling risks. So reviewing and identifying new engineering solutions, improving the layout or workflow, purchase more existing engineering controls, so these may be relating to specific pieces of equipment, identify safe technique and standardise this as well, so ensuring that people know what the expectation is and the appropriate procedure. Write and implement safe work methods. Educate staff on safe moves and what strong postures are as well. Attend to any housekeeping issues, and also reviewing of an individual's posture fitness and making sure they have access to appropriate recovery and refresher exercises that they can be doing throughout the day as well. Okay, so some of the main resources that I've referred today is the Hazardous Manual Task Code of Practice. I'll now open up for any questions if you'd like to submit those into the question panel.
So just a general question that came through, Kirby. The 80-20 rule for the mechanism injury, do you have a reference for that data?
I don't believe I have one here, but if you'd like to pop your details through to Stephanie, what I can do is I can email that information through to you once I've referred to my extra papers.
And just a question in regards, can the Code of Practice be found on the WorkSafe TAS website? I won't say exactly for sure, but yes, we do have a number of codes of practice sitting on the WorkSafe Tasmania website, so if you do head there, and we do have a list of various publications, or if you do a search for that code of practice, then hopefully it should be there. Otherwise, we do also have our helpline which you can contact. So for anyone who would like that, the contact number is 1300 366 322. A question that has come through, Kirby: how do you manage an older worker, an older workforce where their duties are now hazardous through aging?
Mm-hmm. Yeah, and so that may be in relation to they potentially have a reduced level of physical capacity now. So when we are dealing with an older or a mature workforce, it really highlights the importance of going through that risk management process as well. So really relying on looking at ways that we can eliminate a particular hazardous manual task, making sure that we've got appropriate equipment in place as well, but also potentially looking at rotating tasks on a more frequent basis as well to reduce people's exposure, potentially looking at options to cross-train and upskill individuals as well. So then they perhaps have reduced amount of time on a particular or maybe a more physically demanding work task, and then there's a greater opportunity for them to complete some other tasks that have that are of a less physical nature as well.
All right, thank you, Kirby. So there is still time to submit any questions that you have for our presenter this morning, Kirby from IPM Safety. While those questions are still coming through, I'll just again remind people that before they do leave today's webinar, there will be a short survey for you to complete. We do encourage you to provide us with your feedback about today's presentation as well as your webinar experience. And also, if you would like to be part of any other webinars that are coming up, please do head to the WorkSafe TAS website and have a look at the events calendar or download the program and have a look at what other activities we have coming up running until the 30th of October. Kirby, in your experience, and this is a question, in your experience, can I'm not going to pronounce this very well, can tenosynovitis be sudden as well as
Yep.
accumulative?
It would really depend on potentially the individual and the particular work task. A lot of the time that we would see that building up over a period of time, but quite often we may see an onset of symptoms after one particular task, and quite often that is linked to, when we become first aware of the injury, but quite often there is that lead up to it of that accumulation and perhaps repetitive movements or the continuation of certain tasks that then can lead to that point where we start to develop symptoms.
So still a few moments to submit your questions into the question pane, everyone. But just further to what's happening during WorkSafe Month next week, we do have the Hobart Health and Safety Reps Conference on Tuesday running at Rest Point. We do still have space available there, so if you are listening in, if you are a health and safety rep, or even if you do have just an interest in that area, please do again have a look at the program and register for that event. Again, that's happening on Tuesday. Monday, we do kick off our venue sessions and live stream all day. Monday, we're at the University of Tasmania in the Centenary Lecture Theatre, running a number of sessions around how you can be fit for life as well as fit for work. So again, do have a look at the website or the program for activities running on that day. A question that's come through, Kirby: neck complaints due to phone injury. What are the best phones to prevent this?
Yeah, okay, that's a great question. So when, especially in an office environment, and particularly, when we're out on the road, we may be spending a lot of time on the phone. Um, Quite often we may see people, what I call cradling the phone into their shoulder, which is where you kind of tilt your head to the side and elevate your shoulder to hold the phone in that position. That's a big posture that we need to be avoiding. We know that that can put quite a lot of strain through the neck. So a recommendation that I would suggest is potentially looking at a headset to allow you to operate the phone hands-free. And if you're on a mobile phone, looking at a pair of earphones that you can use that connect into the mobile phone as well. And that can also be a great way to help incorporate more movement into your particular work task if it is a long phone call that you're on as well, but definitely looking at some of those hands-free options to ensure that you don't, that we're not moving the head and neck into an awkward posture.
And just another question in regards to it, I guess primarily administration. In regards to office chairs and I guess preventing workplace accidents, should chairs have brakes?
Most of our office chairs don't have brakes. If we are using an office type chair on a hard floored surface, then we can look at lockable casters, which then as soon as there's any weight put on the chair, it does lock those casters into place. So they're really good for hard surfaces. But if you had a particular concern about maybe a type of chair or the floor surface, absolutely that warrants further investigation, and also looking at if a chair mat is needed. Most office type environments have a fairly low pile carpet that allows the chair to move fairly freely, whereas with that the chair mat, that can make the chair move much faster over that surface as well. But most of our office type chairs, when they're used on a low pile carpet, we typically don't have brakes on them. But if there was a particular concern, absolutely you can look at using a chair fitted with lockable casters.
Okay, and we just had a comment come through at the same time, just saying that high friction casters are available.
Great.
Another question, Kirby. Has any research or stats been collected or been done on pre-work exercise reducing manual handling injuries, and where can that data be found?
Yeah, so there are a number of different exercise reviews that have been conducted. I don't have all of those resources with me, but again, if you would like to just provide Stephanie with your personal details, what I can do is then I can either contact you by email or phone to let you know where you can find some of those resources.
Okay, so it appears that we've come to the end of today's webinar. So thank you everyone for joining us for this morning's webinar, Injury Prevention Techniques for Manual Handling. Thank you as well to our presenter from IPM Safety, Kirby Dillon. And as I did mention, when you do leave today's webinar, there will be a short survey for you to complete. So we certainly do encourage you again to provide us with your feedback. It certainly helps us to shape, I guess, the WorkSafe Tasmania Month program for the following year and years to come. So on behalf of WorkSafe Tasmania and also our presenter, Kirby Dillon, thank you again for joining us today, and have a great, safe and healthy rest of the day. Thank you, and thanks, Kirby.